have one of the most rural districts in America, where telehealth, we've done some work on that for the purposes of rural application, but COVID showed us that we need it in urban areas too. And so certainly remote patient monitoring is a form of telehealth that I'm very excited about, so we can have that very valuable visit to a physician perhaps can mean more when data is already available even before the patient walks in the door. And so I'm very interested in terms of, there's some moving parts here of how can we make sure folks have access in rural America. Broadband coverage and internet access is not what it is in other places, so I want to be working on that as well. But obviously there are going to be some barriers, and so Mr. Zengilowski, I was wondering, given your experience in integrating remote patient monitoring into smaller practices, what barriers, other than connectivity perhaps, would you say you've encountered with expanding the usage and utility of RPM?
Yeah, thank you for the question, Representative Smith. I appreciate it. Comments as well. A quick note on connectivity. I do think industry has largely been able to identify various different devices for patients in different areas, whether they have internet access or not. We have a device that will work for the patient. In terms of when we think about the rural patients, what is preventing an expansion of remote monitoring services to that patient population? It is the disparity, the geographic disparity in reimbursement rates. Rural populations, rural physicians are reimbursed significantly less for the same services than physicians in other areas. And Representative Kustoff has introduced H.R. 3108, which aims to solve that problem.